CNA post-hip replacement precautions. Welcome to the quiz. Question 1. You are assisting Mr. Christopher Wilson, a 70-year-old patient, with eating his lunch. As you observe him eating, you notice he is having some difficulty with chewing, seems to be taking very small amounts of food, and is chewing very slowly and carefully. He mentions that swallowing seems difficult sometimes. You are concerned about his ability to swallow safely. When assisting a patient with eating, which observation is most important to report to the nurse? Option A, how much the patient actually likes the taste of the food on his plate or whether he thinks the food is good. Option B, the color and appearance of the food on the plate and whether the portions are an appropriate size. Option C, any difficulty with chewing, swallowing, or signs that could indicate aspiration risk or difficulty managing food. Option D, whether the patient finishes all of his entire meal or leaves food on his plate. The answer is C. Difficulty chewing or swallowing is a critical observation that may indicate dysphagia and aspiration risk. Option C is correct. Taste, food appearance, and meal completion are not urgent safety issues. Question 2. During an educational session on patient confidentiality and HIPAA, your facility's compliance officer is discussing patient privacy and what constitutes appropriate versus inappropriate handling of patient information. She is providing examples of situations and asking staff to identify which would be appropriate. Based on standards for maintaining patient confidentiality and HIPAA regulations, which statement about patient confidentiality is accurate? Option A, you may discuss a patient's medical information openly with anyone who asks, because patient information is considered public information once the patient is in the hospital. Option B, you may share detailed patient information with family members without asking the patient's permission, since family members need to know everything about their relative's care. Option C, all patient information must be kept confidential and should not be discussed unnecessarily with anyone who does not have a medical need to know the information. Option D, you may discuss patient information in public areas of the hospital such as hallways or elevators if you speak quietly so other people will not overhear. The answer is C. HIPAA mandates that patient information is confidential and only shared with those who have a need to know. Option C is correct. Options A, B, and D are violations of confidentiality. Question 3. You are assisting Mrs. Linda Adams, a 70-year-old female patient who has just received news that her cancer has progressed and her condition is becoming terminal. She is lying in her bed with tears streaming down her face, and she is clearly emotionally distressed and grieving about her situation. You want to respond to her in a compassionate way. Based on best practices for responding to patients who are experiencing emotional distress, crying, or grief, how should you respond? Option A, leave the patient alone immediately and avoid her, as her emotional distress makes you uncomfortable. Option B, tell the patient to stop crying and that everything will be okay even though you know her condition is serious. Option C, listen with empathy and compassion, offer comfort through physical presence and supportive gestures, acknowledge her feelings, and notify the nurse so that appropriate support can be provided. Option D, change the subject abruptly to distract her from her emotions and try to make her think about something more positive. The answer is C. When a patient is grieving, empathetic listening and presence are key. Option C is correct. Options A, B, and D dismiss the patient's feelings and are not supportive. Question 4. You are reviewing infection control and the proper use of personal protective equipment, PP, during your training. The instructor is explaining the multiple purposes that PP serves in healthcare settings. Based on understanding of infection control principles and the purpose of using PP, what is the primary purpose of using personal protective equipment in healthcare? Option A, PP is used mainly to make patients feel protected and reassured, even if it does not actually prevent infection transmission. Option B, PP is used to protect you, the patient, and others from transmission of infectious agents from blood and body fluids. Option C, PP is used only to follow hospital rules and policies without any actual practical benefit for infection prevention. Option D, PP is used to limit the amount of time you have to spend directly interacting with patients. The answer is B. The primary purpose of PPE is to prevent transmission of infectious agents, protecting both healthcare workers and patients. Option B is correct. Options A, C, and D are incorrect. Question 5. You are reviewing vital signs for your assigned patients and interpreting what the findings mean. You obtain vital signs from Mr. Marcus Thompson, a 68-year-old male patient, and get the following results. Systolic blood pressure of 120 millimeters of mercury, diastolic blood pressure of 75 millimeters of mercury, heart rate of 68 beats per minute, respiratory rate of 28 breaths per minute while at rest, and temperature of 98.6 degrees Fahrenheit. When reviewing these vital signs and determining if any findings warrant immediate attention, which vital sign would indicate a patient needs immediate attention? Option A. The systolic blood pressure of 120 millimeters of mercury is elevated and indicates the patient is developing hypertension that needs immediate treatment. Option B. The respiratory rate of 28 breaths per minute while the patient is at rest is elevated and could indicate respiratory distress, infection, or other problems that require immediate evaluation. Option C. The heart rate of 68 beats per minute is too slow and needs immediate intervention. Option D. The temperature of 98.6 degree F is normal and all vital signs are normal, so there are no concerns. The answer is B. A resting respiratory rate of 28 is tachypneic, normal 12 to 20, and requires immediate reporting. Option B is correct. BP 120/75 is normal. HR 68 is normal. Temp is normal. So the abnormal finding is RR 28. Question 6. You are providing care to Mrs. Helen Martinez, a 75-year-old female patient who has expressed several complaints about the care provided by another staff member on the unit. She tells you that she feels the other staff member was rude to her, did not listen to her concerns about pain, and seemed impatient while providing care. She is upset and wants someone to know about her experience. You want to help address her concerns appropriately. Based on best practices for handling patient complaints about care and advocacy, how should you handle a patient's complaints about care provided by another staff member? Option A. Tell the patient that her complaints are not your concern and that you do not have time to listen to her problems. Option B. Listen to her concerns, acknowledge her feelings, document her complaint, and report it to your supervisor or nurse so that it can be addressed appropriately. Option C. Defend the other staff member and tell the patient that she is being too critical and should not complain. Option D. Ask the patient to file a formal written complaint directly without discussing it with you or any other staff member. The answer is B. Patient complaints must be taken seriously. Listen, acknowledge, document, and report. Option B is correct. Option A dismisses the patient. Option C is defensive and invalidates the patient. Option D places an undue burden on the patient. Great job! Don't forget to subscribe. Bye.